Hi, I'm Dr. Khurrum Shaukat Yusafzai. In Israel, Professor Dr. Shai Afriti, who is assistant professor at Segal Center for Neuroscience, School of Neuroscience, as well as Hyperbaric Center at the Segal Center at the Tel Aviv University of Medicine. Actually, it's a full university. They have discovered that hyperbaric medicine is treating PTSD, which is post-traumatic stress disorder, at the rates of almost 68%. Almost 70% of the patients are cured without any medicine, just by the use of hyperbaric medicine, which involves treatment inside of hyperbaric chamber. This was reported in the Fox News, as I would show you in the Fox News, and they explained about this. PTSD is actually not included in DSM, which is the Diagnostic and Statistic Manual of Psychiatric Diseases or Mental Diseases. So the Americans have not included this in this manual, but it is considered as a big problem because the war veterans of Americans who went to Iraq and Afghanistan, they suffered too much. And there is one type of PTSD which is called CPTSD. The C means complex PTSD. So complex post-traumatic stress disorder, or CPTSD, it can actually change the behavior of a person. And the change of behavior of this person can lead to the entire change of the personality of this person, and he becomes somebody else. So this subtype of PTSD occurs because of the repetitive traumatic experience, because the trigger for PTSD is the traumatic experience. So if there is a repetitive traumatic experience from which there is no escape, like if a person is a war veteran, he's serving in the military and he's experiencing traumatic events, he would go to CPTSD, and there is no cure for PTSD. Although the people are trying like psychology, which is like cognitive or behavioral therapy, which the US Army is offering, and they have a program in the Walter Reed Medical Center where they're called the Battle Mind program. In the Battle Mind program, they are actually offering psychological therapy without the drugs to the war veterans so they can adjust in the civilian life. But this is not very successful because PTSD, they cannot cure with just talking or psychotherapy or cognitive behavior or desensitization, as they call it. So they are actually resorting to drugs. And what kind of drugs they are using? They are using opioids, they are using antidepressants, and they are also uses psychedelic drugs even. And they have tried some alternate therapies, like there is a blood pressure drug called Processin. So they use a blood pressure drug. They also use glucocorticoids and some other drugs, but they have not worked very well. The problem is this, that research is inadequate for the drugs. But hyperbaric was actually so famous that the war veterans actually went to the American Congress. They actually demanded that America, the government of America or the State Department should give free hyperbaric sessions, which was turned down by the United States government and the Congress and the Senate, because America is a big country, but it is offered for free in Israel. And this is where this research is coming, because the clinical trials are happening there, because the government of Israel provides free treatment to the war veterans. And that's where Dr. Shahi is actually the head of Israeli Hyperbaric Medical and Diving Association, and he's the head of Hyperbaric Center in the Segal Center as well as the neuroscience. So he's in the right place. And the researches which happened in America, Like in America, there were a couple of other scientists and doctors who actually demonstrated this before, and it was replicated in Israel, and they are reporting almost 70%, 68 to 70% success, which is amazing. And this is the reason I put this video for the people who are suffering from PTSD, because hyperbaric working for PTSD as well as depression as well as some similar ailments has been reported. And the reason it's not offered like the mainstream treatment, because the research is lacking. There is no fund for the research, and the hyperbaric machine, the chamber, is a pretty expensive device. It's not commonly available in the hospitals, and for example, in Pakistan, there is not a single one in the private sector. So in most of the countries, it's a rare specialty. Even it's rarer in Israel, but they are doing well. They're doing research, and Dr. Shahi has also established Aviv clinics in America, in Florida, and also he has got an Aviv clinic in Dubai. Before I went to Dubai, I put a chamber there, tried to help with an organization, and after that, the Aviv clinic came. So they are pretty successful. They are offering now a protocol to treat PTSD, and their new research has proved the effectiveness for PTSD. If you really want to understand, like, what are the symptoms of PTSD, you should watch the movie called Cherry. In 2018, a war veteran who was from the US Army, his name was Nico Walker. He wrote a novel about his experiences. He was a good guy. He went to the college, and then he went to the US Army. He became a soldier, went to Iraq and Afghanistan, and he experienced traumatic events, and that traumatic events changed his behavior. So when he came back, he would have nightmares, and he would suffer whatever he saw there. He used to have flashbacks, and he used to hear the voices, and he went to drugs, and even he went to drugs, and his wife was also on the drugs. Although in the movie, there is a movie based on Nico Walker called Cherry. Tom Holland is actually starring in that movie. If you watch this movie, it's by Apple TV. If you watch this Cherry movie, it's a very wonderful explanation of this PTSD. Just like Rain Man showed people what autism, Rain Man, Tom Cruise, and that famous movie actually told people about autism, which still people don't understand completely. So PTSD, if you want to understand, you should watch this movie Cherry. I recommend you to see this movie, and you would understand how Nico Walker, or the actor depicted by the actor Tom Holland, the Spider-Man guy, he changes completely, and he starts robbing the banks. And it's a true story. It's a true story, and he robbed so many banks in Cleveland and he was not caught by police. But when his wife went to drugs and he had difficulty in his life, he actually surrendered to get the help, and he went to jail, and he got rid of his drug addiction, because by that time he was a drug addict, and in order to support the drug addict, he was robbing the banks, and he could not stop. So he went to jail voluntarily by surrendering himself to the police officer, although he had robbed the bank successfully. And then when in the jail, he cured himself of the drugs, and then he started lobbying for understanding of this psychological disease, which is still not in the register of DSM, like Diagnostic and Statistic Manual of the Psychological Disorders of USA. So he was the one who went to even to the American Congress, and he went there after he finished his jail sentence, and he told them about PTSD and the war veterans. Many war veterans came back. Either they committed suicide or killed some other people. So it's a pretty serious disease, actually, and this problem is recognized in America, part of the movies, the novels, and the medical literature is full of them. And this problem is more in Israel because Israel is at war, and it is doing a war, and it has existential crisis because it has to fight this war in order to survive because it's surrounded by the enemies. And they are doing this wonderful work for their military, and they're treating them, and this almost 70% result is very marvelous, and it's like a good news for the medical community. And why PTSD occurs, like, let me tell you the symptoms. So here are the symptoms. As you see the list of the symptoms, there are actually the traumatic events, that the traumatic events, as I talked, can be of war, it can be sexual abuse, especially the sexual abuse in the children or in women after the rape, or in the prostitutes who are in the business. So they have big sexual trauma, and people who are, their loved one suddenly dies, or they're suffering from disease like cancer or leukemia. They can also have PTSD, because PTSD can happen because of life-threatening disease like cancer or leukemia, and also because of many such traumatic events, like an accident, like a car accident, or happening, because car accidents are more common than air crashes and the railway crashes. So car accidents can also produce trigger PTSD. So why PTSD is occurring now? Scientists have recognized the reason of PTSD is actually the lack of oxygen going to the brain, and that lack of oxygen can happen because of the bad blood supply to the brain, or maybe some other reason. And hyperbaric oxygen therapy directly addresses that it addresses the lack of oxygen, and then it triggers healing process, like by increasing the stem cells. As you know, stem cells are inside the bone marrow, and it's produced there and circulates all over the body, but it does not cross the blood-brain barrier, because inside the brain there is another set of stem cells which is called the stem cells of the brain. So that one are difficult to produce. Only hyperbaric oxygen therapy will produce that, because the one you produce in the bone marrow, it will not cross to the brain because of the blood-brain barrier. And this is demonstrated by some neurologists in America. Some wonderful work is there. So when that stem cells increases, it starts healing, and that is the reason that PTSD gets healed. And it can heal stroke, also some other neurological conditions, as well, as I would describe one by one in the other videos. But in PTSD, this is the good effect. Similarly, like depression, scientists have now realized that the reason of depression, because in PTSD, the drugs given are antidepressant drugs, the opioids, and these drugs cause, you get dependent on these drugs, and drug addiction is very common. But hyperbaric medicine does not produce any drug addiction. It will cure the patient, and you are off these harmful drugs, because they have addiction and dependence phenomena. And depression is also similar. Depression, that hyperbaric oxygen therapy is also known to cure depression. So it works in some other similar diseases as well. If you want to know more, you can contact me. Although I'm not a psychiatrist or psychologist, but definitely hyperbaric medicine is helping here. So I hope you liked my video, this informative new knowledge about PTSD, and I hope you like my video, because I'm putting so much effort to bring you such wonderful news about new technology and hyperbaric medicine. And I hope you subscribe to my channel for such informative videos. I thank you very much for listening. Take care. Goodbye.